welcome to the webinar. My name is John Lozier, and I will be acting as moderator for today's webinar, entitled Healthcare for the Homeless Goes to Washington, Legislative Visits During the 2013 National HCH Conference and Beyond, a production of the National Healthcare for the Homeless Council. This is a one-hour presentation with the last 10 minutes reserved for Q&A, questions and answers. We have three fine presenters today speaking from their differing experience as skillful advocates in the healthcare for the homeless field. The first will be Dan Rabbit, who will be hosting the presentation part of this webinar. Dan is the health policy organizer for the National Healthcare for the Homeless Council, works out of our offices of the Baltimore HCH project, and is very active on the Hill in Washington. The second presenter you'll hear from is Catherine Marchman. She's a lawyer and a clinical social worker and works at St. Joseph's Mercy Care Services in Atlanta, a healthcare for the homeless grantee. Finally, Amy Grissett, the past chairperson of the National Consumer Advisory Board and the secretary of the Board of Directors of the National Healthcare for the Homeless Council, will be presenting. I'm very grateful to all of them for their giving up their time for this presentation, and without further ado, would like to turn the microphone over to Dan Rabbit.
Okay, thank you, John. As John mentioned, today's webinar is HCH Goes to Washington, Legislative Meetings at the 2013 National HCH Conference and Beyond. A lot of today's webinar will focus on aspects of what we're going to be trying to do during this year's national conference, but also a lot of it will overlap with legislative advocacy efforts that any of our participants might want to get engaged in anytime, whether at the conference or in your hometown or just generally. Our agenda today will be first going over legislative meeting basics. We want to make this as easy as possible for people. It's really not as intimidating as it may seem to some, but just the basic structure of legislative meetings and scheduling them. Current legislative issues, our three primary ones will be health center funding, low-income housing funding, and Medicaid integrity. The impact these issues have on HCH projects and consumers, followed by the personal experience of Catherine and Amy as clinicians and consumers attending legislative meetings, and then we'll wrap up with just the details of how things will work at the conference. So why are we promoting this? Why legislative advocacy? First and foremost, most HCH projects depend heavily on public funding. The largest grant for almost all HCH grantees is the Health Center Grant. And maybe even more importantly, most HCH patients depend on public support, be that be Medicaid or food stamps or a housing subsidy or SSI. These programs and their continued viability are critically important to the people we serve. Additionally, our broader mission as healthcare for the homeless, as the healthcare for the homeless community, is to try to reduce homelessness. And mass homelessness was caused by and large by policy decisions in the late 70s and early 80s. And only policy decisions will reverse that trend. To emphasize, it is entirely legal to advocate for a certain position to your elected officials. We have other materials on our website that go more into detail on that, but just suffice it to say it is legal. And the HCH community is an advocate already. If you're a case manager or a social worker or a doctor or a therapist, you are advocating for your client all the time, just more on an individual level. Legislative advocacy is, rather than individual advocacy, is advocating for changes to the system. So it really encapsulates the same goals and approaches. So the basics of legislative meetings. I hope you guys appreciate the how a bill becomes a law, Schoolhouse Rock's picture there. Scheduling legislative meetings is not qualitatively different than scheduling any other kind of meeting. You would need to know who your member of Congress is. They can be found at house.gov and senate.gov, or you can call the Capitol switchboard. The number is here. It's included in almost all of our mobilizer publications that go out. I have it saved in my cell phone. And that switchboard you give them your zip code and they will direct you to the proper representatives. When you call, you would identify yourself, briefly mention what you would like to meet about or talk about, and ask to speak to the scheduler. Some offices are different. Sometimes the staff schedule themselves, but asking to speak to the scheduler is a safe bet. When you talk to the scheduler, provide some more detail about what you want to meet about and your availability. And can't emphasize enough, make sure to follow up regularly and confirm once it's scheduled a day or two ahead of time. Congressional offices are really, really busy. It can take several emails or phone calls sometimes to get something nailed down. In preparing for legislative meetings, you want to be prepared. You only have 15 minutes usually during the meeting, so you want to be able to get in, be concise, and get right to the heart of things. You want to know, going in, what is the purpose? What are you trying to get out of this meeting? An important thing to consider is what authority does the legislator have or not have. Going into an office and asking them to do something that is not in their jurisdiction is not very effective. Think about how you'll make your argument. What are the most compelling points that you can make considering who you're talking to and the values and interests of a particular legislator? And what are the likely counterpoints you're going to hear? You want to think about that ahead of time and have responses prepared. Who should attend the meeting? A broad range of people is usually good. Different sorts of folks from your project. Doctors, patients, administrators, board members are all great. The more the better. But think about who is best suited to make a particular point and in what order you want to make that point. What materials will you leave behind? It's always a really good idea to leave something behind. For the purposes of the visits at the conference, myself and other council staff will be putting together materials in a packet for everybody. And where is it and when is it? Make sure to give yourself plenty of time. Navigating the halls of the House and Senate office buildings in D.C. can be a little tricky. And if you're going on your state level or local level, still, it's really important to be on time. During the legislative meeting, it's really important to emphasize that you're a constituent, that your project serves constituents, and really root the importance of what you're talking about and the work that you do in the importance of it to the community and to the constituency of the legislator. Think about the meeting in 3 sections. Like I said a minute ago, we usually only get 15 minutes. And you can kind of divide that into 3 sections. The first section, you're introducing yourself, what you do, why it's important. The second section, you would be describing what the particular issue is that you've come to discuss, how it impacts the work that you do in the community at large. And the third section would be, what is your request to address the problem? And so you'd make your ask and then probably discuss a little bit about, ask is what sometimes people call their request, their legislative ask. So that's a good way to organize it in your mind. An important thing to do is to not get sidetracked. You're going in there, you're seeing memorabilia and really amazing pictures, and there's all this stuff on the wall. It's easy to end up talking about, local issues like where you went to high school or who you know or, where you like to vacation, things that are local to you and presumably the staff you're meeting with. So that's not why you're there. You need to make sure to stay on point and stay focused on your goals for the meeting. Very important, do not answer a question if you don't know the answer. Be honest. That's very common to not know the answer to every question that might come your way. If you don't know, offer to get the information if you think you can. And if you do offer to get the information for the staff person, definitely give it to them, retain that credibility. And take notes. Particularly for the national conference meetings, I hope to be able to get some sense of what what people talk about and what the responses are. So taking notes is very, very important. After the legislative meeting, thank them for their time, stay respectful. Depending on where you're from, you might very seriously disagree with where a particular legislator stands on an issue or two. But it's important to stay respectful. Today's ally, or today's opponent, can be tomorrow's ally, so you don't want to burn any bridges. Like I said, follow up with any information they ask for. Oftentimes the office or the staff person you meet with will say that they can't commit to anything. They'll have to run it by their boss, the legislator or official. That's common, and that's okay. But if they say they're going to run it by them, make sure to follow up and see if they ran it by them and what their boss ended up saying. Plan for long-term relationships and long-term effectiveness. I know one kind of metaphor we often use in some other legislative advocacy trainings is to think about it like you're building a relationship with a client. The skills of building rapport, of meeting people where they're at, of acknowledging, of appreciating why people are doing things, is just as relevant meeting with elected officials as it is in any of the other work that you do. So think about it like that. If someone doesn't understand anything at all about homelessness or healthcare or poverty, you're probably not going to walk out of the meeting having completely changed their mind. But plan for future effectiveness. And be a resource. Stay in touch. If you see something like a document or a report, particularly something that your project might have put out that could be helpful in the work that the staff person you met with is doing, pass it along. That's another way to help build that relationship. So moving on to legislative issues from today until the conference. There's a lot going on. We're not going to talk about all of it, but we're going to talk about the things that are most impactful to healthcare for the homeless projects and partners and consumers. I know in showing the slide to some people, they did not realize why I had an axe here. That's supposed to reference budget cuts, or the budget axe. So that seems to be the big thing that's going on in Congress today. If you haven't been paying close attention, the political climate lately has been bad. Has been very contentious, lots and lots of discord and brinksmanship and disagreement, not a lot of productivity. Deficit reduction has been the really driving force in a lot of decisions that have been made in the last 2 years, really since the 2010 midterm election. And to date, we have had $1.5 trillion in cuts over 10 years, $600 billion in increased revenue over 10 years. And most people think, many public officials and other analysts think we still need more deficit reduction beyond that to stabilize our debt. The main crux of the disagreement lately has been conservatives have been demanding that all deficit reduction come from reductions in spending, mostly to low-income programs, not so much to middle income entitlements or defense, and absolutely no increases in revenue. Progressives or liberals have been saying that there needs to be a balance, a 50-50 split, really, of revenue increases and spending reductions. Why this is really important for healthcare for the homeless is that many see the safety net, the safety net as more vulnerable than other aspects of the budget, because they don't have the safety net does not have as organized or as powerful of a lobby or an association protecting it. And the people who are served by the safety net, low-income people, are not as politically active. We need to make sure that that perception is wrong. And so I'm glad everybody's here on this webinar to learn more about how we're going to do that. Before I go into some more details, I just want to make it clear that knowing all of these specific numbers and details and legislative protocol is not important. It's good to know if you know it, but you do not need to know everything about the sequester or the budget process in order to be effective on a Hill visit. So just want to put that out there. Just to define some things, the sequester was a automatic set of budget cuts put in place if Congress could not reach sufficient deficit reduction last year, or in 2011. They did not reach sufficient deficit reduction, and so it was set to go into effect January 2nd. It has now been delayed to March 1st, and President Obama actually came out today to say that he would like it to be delayed further. So where this is going to be come March 14th and 15th, we don't really know. But if it does go into effect, 50% of the sequester goes to cuts to the Pentagon, 50% goes to cuts to all manners of other spending. This spending would include low-income housing programs, SAMHSA grants, Ryan White, health center program, lots of things that we care about. Lots of things are also exempted, though. Medicaid is exempted, Social Security is exempted, SSI is exempted, food stamps are exempted. So that is the sequester. Many think that it's likely to go into effect, but we'll have to see what happens. And it'd be really bad if it went into effect. The usual funding process, we've been out of it for a while, but funding for FY13, so that's the year that goes from October 1st, 2012 to September 30th, 2013, has not been finalized yet. We're currently funded through, we meaning the whole government, is currently funded through March 27th, and they will have to pass other legislation in order to fund it past that. Some in Congress have threatened to shut down the government or to not pass additional legislation unless the legislation is to their liking, which would shut down the government for some period of time. The major priorities we have, we're health and housing. So health center funding for 2013 is still up in the air, and low-income housing funding for 2013 is still up in the air. An issue with the health center funding is that the President's budget instructed HRSA, who distributes health center funding, to not use all of the funding for expansion that they have available. The Senate bill did instruct HRSA to use all of the additional funding provided under the Affordable Care Act for expansion of services and sites. We definitely support the Senate approach. On top of all of this, the FY14 budgets are coming out soon. I won't go into detail about what all that means, but included in these budgets might be instructions to change entitlements, to change taxes, to replace the sequester. The House has said they're going to release a budget that balances the federal budget in 10 years without increasing taxes. That will result in huge cuts to all programs probably. The Senate has supported a more balanced approach. I don't know if these budgets will be out by March 14th, 15th, but if they are, that'll be a big talking point. And if not, there might still be some opportunity to influence what is in them. So it's kind of gone over a lot of legislative uncertainties. We really don't know exactly how these things will play out in the next 6 weeks. But what we do know is that March 14th, 15th, the time we're going to be in Washington, is going to be a very important time. We do know that the decisions are going to impact our projects and our patients. And we know that the HCH community is the best advocate for the priorities of the HCH community. You guys see what's going on in your clinics and your consumers' lives, the funding streams that you depend on, the impact that they have on your community. And so providing those real-life examples is really the best thing that we can do in these meetings. And we need your help. We know that. We have a lot of people coming to the conference, and the more people we can get up on the Hill, the better. So what are our priorities? I kind of went over what's going on in Congress. These are the 3 issues that we're going to be focusing on during these visits, and what I'll be focusing on in our advocacy work at the Council. Health center funding, low-income housing funding, and Medicaid, particularly preventing any changes to the federal funding of Medicaid. To go into some more detail about why these things are important and how the HCH community can best make their case, I'm going to pass it over to Catherine Marchman to take us through that. Catherine?
Okay, thank you, Dan. All right, so like Dan said, we are going to look specifically at these 3 legislative priorities for the Council. Starting with the impact of health center funding. So as Dan mentioned, there's sort of 2 possibilities here. If sequestration occurs, obviously there would be no expansion for health center funding. which would lead to a reduction in a lot of things. It would lead to a reduction in the number of patients served, the number of services provided to patients, the number of jobs for providers, and as you could imagine, we could sort of go on in thinking about what reductions would occur here in terms of the services and the scope of our service, provision of services. Also, it would lead to, so at present we're working here in Atlanta on reducing the unmet need with other safety net providers, one of which is Grady Memorial Hospital in the picture there. And so obviously these cuts would only continue to grow and grow to more unmet need, which is not good. With the regular 13 appropriations, as Dan mentioned, we have the President's budget versus the Senate bill. We are obviously strongly in favor of the Senate bill. Why? Well, just in terms of the numbers alone, we are looking at $300 million versus $19 million. So, that is it's a huge amount, and the amount of expansion that could occur with that increased funding is very large. So how do we want to frame the health center message? For starters, we'd want to encourage our representatives to support the Senate bill. The second thing we would want to do is educate new members. So we can't sort of underestimate what new members on the Hill know or don't know about these issues that we see day in and day out. So it's important to sort of take a moment to figure out who you're going to see, what their background is like, where they're coming from. You can pull up their website and see what their experience is. I mean, you might have somebody from the insurance field, or you may have somebody whose their history in the workforce has been completely unrelated to healthcare. And so you kind of have an idea going in on what they may or may not know about these issues. Specifically speaking to St. Joseph Mercy Care Services, we rely very heavily on health center funding. So as I'll talk a little bit later on regarding Medicaid, our patient revenue from Medicaid and private insurance is extremely small. So, which means that any cuts to health center funding would be potentially tragic to the services that we provide on a day in and day out basis. So again, funding cuts would lead to a decrease in patient care and services that we provide here on site. It would lead to fewer providers. It is already very difficult for us to hire and retain healthcare providers. And with more limited funding, this would make it even more difficult. And again, going back to what I talked about previously with Grady, with our safety net, for other safety net providers, this would just create a greater strain on our safety net here in the Atlanta area specifically. So you would want to speak specific to your area, your region of the country, and how that might impact what you're doing on a daily basis. So looking at now the impact of low-income housing funding. If sequestration occurs, we estimate a loss of approximately 111,000 Section 8 vouchers. In Georgia specifically, that would be about 2,700. And I shudder to think what would happen if primarily our Section 8 vouchers in Georgia are held by women with children, families. And so I shudder to think what would happen if 2,700 of those all of a sudden were on the streets of Atlanta. Additionally, this would lead to thousands with disabilities who would lose supportive services. So again, many folks with disabilities, as you all know, end up in supportive permanent housing programs. Attached to the permanent housing comes supportive services. And as has been my experience, formerly homeless individuals cannot maintain permanent housing without additional supportive services. And finally, hundreds of thousands of vulnerable and low-income households would lose housing or shelter. So framing the message. Well, and it's getting to be rhetorical at this point, but housing is healthcare, right? And we know this, and so, but you may need to think about this in a very nuts and bolts sort of way for your representatives. So breaking that down for them and explaining why being without housing will lead to all kinds of bad things. So for us here in Atlanta, our housing for individuals who are homeless is extraordinarily limited. And so that puts strains on us as a healthcare provider because all of their medical outcomes are getting worse and not better. And it limits, it limits our case management programs in terms of being able to place individuals into housing. And housing has been cut already, so further cuts would just make all of these things worse. And again, a decrease in housing, is sort of a snowball effect. It impacts every other social service provider in any given city or area. So when someone becomes homeless, as you all know, that they then become even more reliant on the social service sector and create much greater strain. And another point, that I didn't really think about that I found was so housing cuts, which lead to evictions, which leads to increased shelter, and this is what we saw with the economy going down in 2008, is ultimately as people became evicted and lost housing, those homes began to deteriorate. The physical space of the home began to deteriorate, which then led to degradation of neighborhoods and has really also impacted the economic growth of our neighborhoods. So I thought this was important to include on the slide because this is not just a micro matter. It's also a very much of a macro sort of economic matter that can be expressed to your representative as well. So this is going to impact the economy at large potentially. And I threw in a picture there of some small little shacks in Atlanta. This is something we would also be talking about to our representative, that we have these tent communities all over Atlanta because of the lack of affordable housing and housing for individuals who are disabled. All right, so the impact of Medicaid. Any reduction in federal funds is going to impact states. It's going to impact individuals who receive Medicaid currently, and it's going to impact providers. States are either going to cut eligibility, they're going to cut benefits, they're going to increase cost sharing, they're going to cut provider rates, and or they're going to raise taxes. So all of these things could occur, or one or some of them. And it's also going to lead to the reduction of the likelihood that a state will choose Medicaid expansion. So if you're in a state that has already chosen to expand, you don't necessarily have to worry about that. But if you're in a place like Georgia, this is a big concern for us. So how do you frame the Medicaid message? And I think the bottom line here is that this is going to be a different message for your individual agency, your individual sort of region and state. As I mentioned previously, our current patient revenue for Medicaid is small. However, our other safety net providers in the area do see a lot of Medicaid patients. And so for that reason, if Medicaid is cut and provider rates go down, or eligibility, they cut eligibility requirements and make it more difficult for patients to get in to see who have Medicaid to get in to see providers, and that's going to strain all of our capacity. If we have suddenly an influx of patients with Medicaid because they can't get in anywhere else, it's going to strain our capacity. So you kind of have to look at it individually in your own area. And then also you can define this for the individual patient. So again, this can limit access for patients. It can lead to continued uninsurance if your state is going to then choose, as a result of Medicaid funds, not to expand. So that's Medicaid. Experience as a clinician. I had the opportunity to go on the Hill Visits 2 years ago at the conference in D.C. And I think my biggest takeaway was to tell your story, to tell your client, your patient's story, and that you're sharing a lived experience, which, again, may or may not be one that your representative may have had. So maybe your representative has, been a volunteer in a soup kitchen, but do they really know the stories that you know? Do they really know how your hands have been tied due to decreased funding and your ability to, to really impact patients and access services and housing and that sort of thing? So, I recommend that you pick one or two sort of very compelling stories to share, and to share those, and those can be much more compelling than just even hard facts or data. And so lessons learned. To be concise and to the point, I think Dan mentioned that as well, to be honest and respectful, to be yourself and be passionate, so don't let nerves, I think I was very nervous going in, and don't let nerves take away what you have to share, and again, that sort of lived experience that you have to bring to the table, because that's very unique, and that's going to be very compelling. And then ultimately, when you go in there, remember that you are bringing a voice for the voiceless, that, our patients don't have this opportunity frequently to go in and talk to their representatives and to do this. And so that is our purpose at the end of the day, is to do that for our patients and to be an advocate. And also don't underestimate your ability to raise awareness and build support, and don't underestimate the impact that you can have. So with that, I'm going to turn it over to Amy to talk about her experience as a consumer.
Thanks, Catherine. Yes, I'm going to just talk a couple of minutes about my experience as a consumer, and I've had lots of different kinds of opportunities. I work at the health center where I received services while my family was homeless, so I'm very passionate about health center funding, and have worked with local congressmen in my community around those kinds of issues, and also had the opportunity to speak at a joint congressional meeting at the U.S. House several years ago on family homelessness, and it was seemed a little overwhelming at first because I had never been into the building, but once I got into the room, I was a little bit more at ease, and what I noticed was the podium with the seal, the U.S. House of Representatives, and it was made out of paper, and I thought that was kind of funny that they wouldn't have something a little bit more expensive, so that kind of put me at ease. But as far as the Hill Visits, I have had the opportunity to do that with other consumers from my city in Worcester, Mass. And it was relatively easy to schedule that meeting, and just called my local congressman's office and scheduled it. And I already have a relationship with him because he's a huge supporter of our health center. So it was relatively easy, and actually spent more than 15 minutes with us, was very cordial, was very open to listening to us, and it went very, very well, I felt. And then some lessons learned, I would piggyback on some of the things that Dan and Catherine said, to be prepared, know your material before you schedule that visit, know where you stand on the issue, and also where the person that you're speaking to stands on the issue. Be clear about why you're there, be yourself, be professional, try not to be nervous. It can be a little overwhelming, but take your time and really show your passion for the issue. And I would also say, like Catherine said, share some stories or examples of things, especially from a consumer's perspective, of some of the things that you faced while being homeless. I think it's very powerful for our congressmen to hear those sorts of stories, and personalize the issue. How's my family been affected, or someone that I knew? So all those things are really important. But just be yourself and try not to be nervous. And with that, I am going to turn it back over to Dan.
Okay. Thank you, Amy, and thanks, Catherine. So those are hopefully a couple examples of how this can be fun and satisfying and not too scary. It really isn't. I'd like to emphasize that, at least for your elected officials, elected representatives, they work for you. So if you reside in their district or your project serves their district, they're going to be they're going to be respectful and open to what you have to say. So please bear that in mind. So to end the last few minutes of our webinar prior to question and answers, we're going to go over how things are going to work at the conference itself. We have many hundreds of people come into the conference, and we have it every other year in Washington, D.C. to facilitate people going on legislative meetings, maybe people who don't make it to the Washington area very much. The way that we are approaching it this year is the key part of it is identifying a state team lead for each state, or we're probably not going to get a team lead for every state, but for as many states as we can, to volunteer to kind of take a larger role in the scheduling and coordination of the Hill Visits. I'm going to work as much as I can to help coordinate. This is one of my primary responsibilities over the next 6 weeks. But we would really like to see more of a critical mass of meetings scheduled. And so identifying these team leads is really critical. In addition to team leads, we have been asking people if they're interested in going on meetings. For those of you who've registered for the conference, you might have seen a little checkbox when you registered asking if you wanted to receive information about attending a legislative meeting. You might have already been receiving some emails from me as well. Team leads are important, but having people to participate is just as important. In some states, we've received an enormous amount of interest. In other states, not so much. But so if you're listening at home and did not check that box and would like to attend, please contact me. And if you're interested in volunteering to be a team lead, please contact me as well. In terms of written materials and talking points, we're going to do as much of that for attendees as possible. We meaning council staff. We're going to have some documents made and included in a packet for each meeting that each state team schedules. And we're also going to have a meeting scheduled for Wednesday, March 13th at the conference. It'll be at the hotel that the conference is being held at. Wednesday, March 13th is the pre-conference day, but hopefully most people will be arriving that day, and people who are interested can attend. Even if you haven't had any communication with me or your state team lead to that point, that meeting is open, and anyone can come and get filled in on what meetings have been scheduled and get materials and get to ask questions and things like that. So just to emphasize it, we still need to identify some team leads for some states. So if you're interested, please contact me. My email address will be listed at the end of the webinar. It won't require a whole lot of work on your part, hopefully. That's our goal. The main thing that we're asking team leads to do is just take the lead in scheduling the meetings. So that would be calling. We're asking each team lead to schedule 3 meetings. So call 3 offices, probably play phone tag a little bit, and get 3 meetings down on the schedule. I will assist in coordinating all the people who want to attend but didn't want to schedule the meeting. I will be helping to get all the materials together, and at the conference, we're also asking that team leads make their best effort to attend all the meetings that they schedule. In some cases, that might be difficult if you have a lot of conflicting obligations. There isn't any time set aside at the conference for legislative meetings, so it will overlap with workshops or plenary sessions, and so that has to be taken into account. But one of the great things about the hotel that the conference is being held at is it's 5 minutes or so from the House and Senate office buildings. Again, if you'd like to be a team lead but have other things going on at the conference, you can just let me know and we can try to make other arrangements. Some more details. If you volunteer to be a team lead, I will be getting you the members of Congress that are important to meet with. That'll be dependent on the committees that a given Congress man or woman sit on. Certain committees have more jurisdiction over our issues than others. I've been keeping a list of all the attendees who are interested in participating in meetings, so I'll help you coordinate with them. I'm also going to kind of cross-tab to see who is interested in attending and who is a constituent of what members, so I'll help you with that, and give you additional information about if a particular member has a history of supporting or opposing something, or has introduced things in the past that would indicate kind of where they sit. In terms of communicating with people interested in attending the meetings, that depends on what a team lead is comfortable with. I could just forward you the contact information of the people who are interested, and you can take it from there. If you want me to kind of remain an intermediary, I'm happy to do that also. Really, we'll take it on a case-by-case basis on how we'll approach a given state team. For team leads, once you have scheduled meetings, please let me know when they are. And if you're having any difficulty scheduling meetings, I'll keep a list of that, and that will assist us in just coordinating and making sure people can get to the meetings. Talked a lot about team leads, but really there's no meeting if it's just a team lead. We need other people to attend. So if you're interested in attending, please contact me. There will be that meeting on Wednesday, March 13th, where you can come and hear more. Really, you don't need to have a whole lot of prior experience doing this. You don't need to have any prior experience doing this. You are the expert on your work in your communities, and that's really what people need to hear. Another thing to emphasize is, I haven't mentioned this yet, but you're not probably or almost certainly not going to meet with the member of Congress themselves. You're going to be meeting with staff in all likelihood. Don't discount this. Meeting with staff is still really important. Members of Congress are really busy and don't have time to vet issues oftentimes, and it's the staff's responsibility to bring issues to them. So the staff is really important. So please don't, keep that in mind. And also bear in mind that mostly, a lot of the time, the staff are going to be young. The staff are going to be, in their 20s. So hopefully that will help the process of doing legislative meetings be a little less intimidating. As I mentioned, the hotel is really close to the House and Senate office buildings. Can't tell if you can see on your screen. I know this map's a little busy, but the hotel is slightly behind the Legend in the upper right-hand corner. And then number 1, 2, and 3 are the Senate office buildings. And then over there on the right-hand side, and numbers 8, 9, and 10 are the House. So basically the Senate office buildings are a 5-ish minute walk, and the House office buildings are a 15-minute-ish walk from the hotel. So that's good. That's a strategic location. And again, just to go over the logistics, that meeting on Wednesday, March 13th will really be an important opportunity to meet who is on your team, discuss some of these strategies that we've been talking about earlier in the webinar, get materials, ask questions. If you can't make the meeting but are interested anyways, just contact me and we can make other arrangements. There's also a website. It's our regular website, nhchc.org/Hill Visits 2013. It's also linked to our 2013 National Conference page. And that will provide up-to-date materials, information on what meetings have been scheduled, what states have meetings scheduled. A lot of things might happen between now and March 14th and 15th again. So that's where I'm going to post updated information. I'm here to support, so you can call my cell phone is listed there. My email is listed there as well. And again, there is not time set aside. So in scheduling meetings, make sure to schedule them around workshops that you really want to attend or might be presenting at, or important other prior obligations. The agenda is up, by the way, so if you want to look through to see what workshops are being held when, that is available there. And so that's kind of the logistics. Hopefully I made the process clear to you guys, and if not, you can always ask some questions now. And I'm going to pass it over to John to moderate our Q&A session.
Thank you, Dan, and I don't have a lot of moderating to do. The questions that have come in are questions that were subsequently answered by presenters. They had to do with what's a Hill Visit really like, and what are these staff members we're anticipating meeting going to be like. That answer was young. And a question about the meeting at the HCH conference, which you will all have more about in the mail, but you do know that we will be meeting. If any of you have additional questions, you can still type them in as I do a couple of things to close this webinar. I want to thank you all for joining it. There were nearly 30 of us on the webinar. It was produced by the National Healthcare for the Homeless Council and will be archived on our website within 3 business days. I want to mention some upcoming webinars produced by the National HCH Council. The next will be on February the 19th at 1 o'clock Eastern on the integration of behavioral health care and primary care for people experiencing homelessness. The following day, February 20th at noon Eastern, we'll have a webinar on employment support in the HCH setting. And then a week later, on February the 27th, a webinar at 3:30 Eastern on Medicaid eligibility, enrollment, and outreach, a very crucial piece given what's going on in the policy world and with the Affordable Care Act. If there are no further questions, I'll thank you again for participating in this webinar, for coming to the National Conference, and for being advocates for your clients. Looks like maybe we have a question coming in.